Today, the authorization for the President's Emergency Plan for AIDS Relief, known as PEPFAR, expired. Launched under President George W. Bush, the program has played a critical role in addressing the AIDS crisis, especially in Africa. Its future is now uncertain as the Trump administration freezes grants and reduces international aid. Joining us tonight is Hannah Johnson, Senior Program Manager for Global Policy at the George W. Bush Institute. Thank you so much for joining us. Remind us what PEPFAR does and its objective.
Well, thank you so much for having me. So for those of you who don't know, PEPFAR was created in 2003 after the HIV/AIDS pandemic was ravaging the entire African continent. Today, it's a program that saved 26 million lives, including nearly 8 million babies born HIV-free as a result of the program. It seeks primarily to make sure that folks who are HIV positive know their status, to make sure that they have access to life-saving antiretroviral medication, and to make sure that they have undetectable levels of HIV in their blood, making it untransmittable to other people. It is more than a global health program, too. It's been able to strengthen the United States' relationships abroad and to build connections that really are a national security imperative.
And Hannah, during the freezes in the Trump administration, has it affected the program, or has PEPFAR been able to get waivers?
So Secretary Rubio did the right thing last month by issuing a waiver that exempted life-saving PEPFAR programming from the overall pause in foreign assistance. This included treatment programming, included preventing mother-to-child transmission programming, and other programming that looked at diseases that would impact people living with HIV the most. Much of that programming was able to get up and running because PEPFAR operates actually under 7 different agencies. But there were several challenges that came with pauses and subsequent terminations to foreign assistance through USAID. The good news is that as the administration and as members of Congress look deeper into this and they listen to folks on the ground who are experiencing these issues, these programmings are slowly starting to get back up and running, but there's still challenges. Health systems are very complicated.
And what about reauthorization? Will that happen, do you think?
So reauthorization lapsed today. Thankfully, that doesn't mean that the program stops. Funding still continues regardless of reauthorization, but there are key provisions within the legislation that will expire, like certain percentages of the funding going to treatment, certain percentages going to orphans and vulnerable children, and even the capped amount that the U.S. gives to the Global Fund.
Will the former president be doing any lobbying on behalf of PEPFAR?
I can't speak to President Bush and to the work that he does, but at the Bush Institute, we really do focus on policy and solutions-driven policy. Our work focuses on taking a look at these programs that work really well, making sure that folks know about them and know about the lessons that we can learn from them. Like I said, PEPFAR has saved 26 million lives. It's a program that is really one of the most successful in foreign assistance in history. It creates those long-standing connections. It strengthens health systems that helps us to be able to combat other diseases like Ebola and COVID-19. It also allows us to create really long-lasting, strong relationships with growing economies across the world.